Hello everyone, welcome to AY Tutorials. Today we are going to study diabetes mellitus. Content of the video includes introduction to the diabetes, types, signs, symptoms and complication of the diabetes mellitus, also pathophysiology, oral manifestation and complications and dental management consideration. Introduction. Diabetes mellitus is the group of metabolic diseases. Metabolic diseases means when body is not able to convert food into energy. It occurs because of certain reasons like chemical reactions, genetics and also organ function. Here in which there is high blood sugar level over a prolonged period of a time. Here two blood vessels are there. In first blood vessel there is normal amount of glucose, and in second blood vessel there is excessive amount of blood glucose. If diabetes is left untreated, then diabetes can cause many complications, includes ketoacidosis. Ketoacidosis means body loses its fat to form energy, which is a life-threatening condition, and non-ketotic hyperosmolar coma and also death. Diabetes is due to either the pancreas is not producing enough insulin or the cells of the body are not responding properly to the insulin produced. These are the two main reasons of diabetes mellitus. Type 1 diabetes mellitus. It results from the pancreas's failure to produce enough insulin. Whenever pancreas is not able to produce the enough insulin, then this type 1 diabetes mellitus occurs. Type 2 diabetes mellitus, it begins with the insulin resistance, which is the condition in which cells fails to respond to the insulin properly. So the reasons of type 2 diabetes mellitus is genetics or some lifestyle changes and also the some other health conditions. One another type of diabetes mellitus is there, that is gestational diabetes. It is the third main form and occurs in a pregnant woman without a previous condition. Here is the comparison of type 1 and type 2 diabetes. Onset of action, sudden and gradual. Type 1 is sudden and type 2 is gradual. Then age at onset. Type 1 diabetes mostly occurs in children and type 2 in adults. Body size. In type 1 there is thin or normal body type, and in type 2 often obese. Then a ketoacidosis is very common in type 1 and rare in type 2. Then autoantibodies usually present in type 1 and absent in type 2. Then endogenous insulin is low or absent at type 1 and normal, decreased or increased in type 2. Some signs and symptoms of diabetes mellitus. Central symptoms include polydipsia, polyphagia, lethargy and stupor. Systemic includes weight loss. Respiratory includes cusomal breathing. Gastric symptoms includes nausea, vomiting and abdominal discomfort. Then breathing, smell of acetone, and eyes, blurred vision. Signs and symptoms: weight loss, polyuria, that is increased urination, polydipsia, that is increased thirst, and polyphagia, that is increased in hunger. Some additional signs and symptoms includes blurred vision, headache, fatigue, slow healing of cuts, and itchy skin. If prolonged high blood glucose level is there, then there is the absorption of that glucose in the lens of the eye, which leads to the changes in vision. So it causes the blurred vision. Complications: all forms of diabetes increases the risk of long-term complications. These typically develop after many years, that is after 10 to 20 years. The major long-term complication is related to the damage to the blood vessel. Then diabetes doubles the risk of cardiovascular diseases. About 75% of the deaths in diabetes are due to the coronary artery disease. The primary complication of the diabetes due to the damage in small blood vessel includes damage to the eyes which causes the blood vision, then kidney and nerves also. Damage to the eyes, also known as diabetes retinopathy, is caused due to the damage to the blood vessel in the retina of the eye and which can result in gradual vision loss and blindness. Damage to the kidney, known as diabetes nephropathy, which can lead due to the scarring or urine protein loss, and eventually chronic kidney diseases occurs. The symptoms can include numbness, tingling, pain, and altered pain sensation, which can lead to the damage to skin. Diabetes related food problems such as diabetic foot ulcers may occur and can be difficult to treat, occasionally requiring amputation. Diabetic amputation is the condition whenever we are not able to control the blood sugar level. There is the damage of nerves and which causes a decrease in the blood flow at the infected area, and so amputation requires. We will see another part of the diabetes mellitus in the next video. So if you like this video, please like, share and subscribe to the AY tutorials. Thank you.